Bismillahirrahmanirrahim. I hope you people are doing well. And in this new video, I would be talking about a disease called Keratoconous. And as I try my level best to make the videos short, I will start instantly. A patient, first of all, Keratoconous is a disease which has three uh, signs or a triad. Number one, cornea takes up a conical shape. Secondly, it becomes thinned in a certain area. And number three, the astigmatism starts becoming against the rule. So it is a progressive disease of the early childhood to young age. The possible scenario for undergraduates can be somewhat like this. The scenario will be a 15-year-old boy presented in IOPD with the complaints of frequent changes of glasses for the last couple of years. On examination, his visual acuity was found to be 6 by 6 in the right eye and 6 by 18 in the left eye. On slit examination, no positive finding was found, and on distant direct ophthalmoscopy, oil droplet sign was found. If you have read it and you have you know what is keratoconus, the possible stem can be number one name, the diagnosis is keratoconus on the basis of what are first of all I would like to tell you what are the hints in this scenario. Number one, as in keratoconus, the progression of the disease causes thinning of the cornea, which leads to corneal ectasia in a certain direction, infratemporal or intranasal or anywhere else. And astigmatism, which is with the rule, is when it is at 180 degree, and when it starts going opposite or it is at 90 degree, it is against the rule. So the frequent changes of glasses means that because of thinning of the cornea, his number is constantly being changed, and thinning of the cornea is causing the astigmatism, which is making the optician difficult to make glasses which fit for that patient. And when he wears the glasses, it works for a couple of months, and then again, uh, because of the progression, he has to go to the doctor or optician again. Second, very important clue in this scenario is oil droplet sign on distant direct ophthalmoscopy. Oil droplet sign is somewhat like when you see through the distant direct ophthalmoscopy from 1 meter. In the pupil, you would see a blackish reflex in the center and a round reflex in the periphery. Normally, it should be all pink red reflex. And and this is also because of the conical shape of the cornea. So the stem number one can be named the diagnosis. So diagnosis is keratoconus. Number two, enlist two other diseases in which cornea changes its shape. Number one, keratoglobus, corneal pellicid degeneration, and there are a couple of others, but uh, these are also rare, but relatively they are seen in clinical practice. And number three stem can be what is the latest method of treatment, or name the procedure by which we can decrease the progression of the disease. The answer is cross linkage, corneal cross linkage, which is also called CXL. Now, in the end, some important facts. There can be some other questions in treatment options when glasses are not suitable. Then we ask the patient to go to the optician, and he is given the hard contact lenses. These are specially made lenses according to the shape of the cornea, and patient becomes 6 by 6 by hard contact lenses, and they also uh, you can say lessen the progression of the disease. If the disease progresses, then the only option we are left with is penetrating keratoplasty, that is corneal transplantation. And keratoconus is the disease of the eye in which the results of the keratoplasty are the best. There is no vascularization, cornea is healthy, though it's not in its good shape. So the donor cornea usually does very good, but keratoplasty is done at the very late stage, and not every person needs the keratoplasty. So I will stop here. Uh, I went live here, and if you have got any questions, please leave in the comments box. I will try my level best to answer, and please let me know what you people want to know about the eye ophthalmology, and hope to see you again. Allah Hafiz.